Nyeho Medical Center was founded by my dad in 1970. So it was the first private group medical practice in Ghana and brought together people, so doctors. And Ghana didn't have a lot of doctors and still doesn't. So what's unique about us is that we bring and pool together all the top specialists so that they can work collaboratively for the patient. And so I was privileged to come back from the UK to Ghana about 4 years ago. Took over from my mom, family business, and went through a significant transformation.
So this sounds like you embody this principle of the life of Re through your practice. What does life of Re mean to you?
Well, actually, it's so important, self-awareness. I mean, I think self-awareness is the key, the first start, and always being a learner. So I've never assumed I knew, and I think my medical background means that you're constantly learning about people, about how you communicate. So yeah, the life of Re, which is the theme for YPO this time around, is a personal mission for me because I think I really want to do a good job. I want to leave a legacy. I want to have an impact, and I really want to honor the trust of patients when they come to us.
Tell us a bit about how your medical centers are sort of changing the face of access to healthcare in Ghana.
So access to healthcare, big problem in Africa and also in Ghana. So we started trying to increase our footprint, so expanding geographically. So started moving to where our patients were, and also started to look at how do we innovate to lower the price. So increasing quality, so really quality is always a key, but then also going at a lower cost. So we started doing things like design thinking to really be more patient-centered and designing for patients. So we're building a mother and child unit, which was all the feedback we generated using that. And then also training other doctors. So we are privileged to be the only private hospital in Ghana to train family physicians. And so family physicians will become the leaders in primary healthcare and more preventative healthcare, which is a strong tool to transform our country.
How do you build satellite clinics? What does that entail, really?
So we've just started that journey. We are learning. So we consider the first one was a pilot, where we really went in and started to use the learning to build a framework. And with the framework, you use all the system thinking to optimize and improve your supply chain, your logistics. I say we went down and we're coming up. And I think that's obviously the journey of a transformation that you do need to risk and you do need to try and go out there and learn. You don't get it right the first time, but there's a second time.
How do you use innovation to drive down the price?
So actually, what's interesting is that we have to speak and engage our staff.
And that's